single most important factor that can get you to pass or fail your AMC clinical is going to be how well you rule out differential diagnosis. If I were to say the second most important factor, that's going to be how well structured you are. So we're going to talk about differential diagnosis in this video. The first question that comes is, how many differentials should you say? The simple answer is as many as you can, as many relevant differentials as you can. So for example, if your patient has got forefoot pain, you need to rule out differentials of forefoot first, then midfoot, and then hindfoot. For examples of forefoot are going to be bunion, osteoarthritis, calluses, Morton's neuroma, and ingrown toenails. So after that you move to the midfoot, after that you move to the hindfoot. So my point is that you need to rule out relevant differentials first. How many should you? As many as you can. There are some clusters like chest pain that have got 10 to 15 differentials. There are some clusters like hand pain that will only have 5 or 6 differentials. So remember as many as you can and as many relevant as you can. The second point is how to remember differential diagnosis. When you're preparing for AMC clinical and you're doing differential, you're learning them for the first time, try to learn them anatomically. For example, if your patient has headache, just think of skull. Just think of the entire head. You've got skull first, so trauma fracture first. Then you've got meninges, so meningitis, subarachnoid subdural hemorrhages. Then you've got brain, so intracranial hemorrhages, encephalitis. Then you're done with the brain, then you come to this part. So tension headache, migraine, and cluster headache. Then you talk about the eyes, optic neuritis. Then you talk about the jaw. Let's say temporal joint problems and sinusitis in the cheeks, and then dental problems. So my point is, think anatomically to remember the differential diagnoses. That's the first point. The second that I want to make is, do not speak in your exam this way. You need to rule out the red flags first. So out of all of the differentials that I told you, the most important ones were hemorrhages and meningitis. So in my exam, I'm going to talk about hemorrhages and meningitis first, and then I'm going to talk about cluster headaches, trauma, skull fracture, optic neuritis, jaw problems, temporal arthritis, and things like that. So to summarize, I've just talked about 3 points. Number 1 is differential diagnoses are utmost important to pass your AMC clinical. Number 2, speak relevant ones first and as many as you can. Number 3, how to remember them. Remember them anatomically. And number 4, how to speak them in your exam. Speak them by saying red flags first, then the most probable ones, then the rare ones. I hope this helps you.